Good evening, this is Dr. Brett Butterfield. I wanted to share with you a technique which I found to be very profound, very powerful, which uses essential oils. Okay, now there's a lot of different ways you can use essential oils, but this specific technique can be applied to physical healing, but is primarily used for profound emotional healing. Now, of course, you have a mind-body connection. So sometimes we need to treat the mind in order to treat the body. So with this technique, I combined two different techniques. So there's a woman who's dedicated 40 years of her life to discovering the emotional healing benefits of essential oils, and specifically for young living. And her name is Carolyn Mind. She's a chiropractor, an acupuncturist, and she's got all kinds of credentials. So she wrote this book, and it's called Releasing Emotional Patterns with Essential Oils. And this is a great book if you use oils. I recommend it. I think it'd be a great asset to you. So it combines some of her techniques, and then I was at a conference within the last couple weeks, and I learned a technique that fits in really well with this, with her work, but I think it makes it much better, honestly. And so I'm going to share with you this hybrid technique, and I think it really can provide a lot of relief for you. So first thing, you have to choose your life situation or physical symptom. Okay, so maybe there's a situation in your life that's creating a lot of emotional turmoil, or you might start with a physical symptom. And so you would choose whatever organ or part of your body is tied in. So that's your starting point. So once you have that, you can find it in her book here. So you would either find the body point or organ, or you would find the emotion. And so I've just chosen one to do for today. I chose depression. Okay, so we have our negative emotion. And with the emotion, there's 5 columns. So we have the emotion, that kind of the negative emotion, but then there's the other side, which is the positive emotion. And then there's a phrase which we use, which is she calls the way out. Okay, and then she gives a recommended oil, and then a recommended body point to apply the oil. So a part of on your skin where you would apply the oil. So I'm using depression, and she, with her original technique, she would just have you think about the feeling of depression, but is what I'm recommending is you actually think of a situation where you feel this emotion, so depression. So this could be a current situation, or it could be a past situation. Just whatever is the most real to you, that's the situation that you want to use. Okay? Now, the body point that she has for depression is actually just called depression. So it's not representing an organ, but it's specifically for the emotion of depression. And it's right here behind the ears. And she recommended an oil which is called Peace and Calming. I'm going to be using lavender, okay? These are not set in stone, these rules. So if you're my patient, I may give you other body points that she doesn't recommend. I may give you an oil that she doesn't recommend. It's malleable. Okay, so I'm going to use lavender, and all you really need typically is just 1 drop. So I'm just going to get a little drop here. Okay, and so I'm going to apply a little bit behind my ear on the depression point. And then I like usually either applying some of the oil to the temples or sometimes to the forehead. This is your prefrontal cortex. And get underneath the glasses there. I'm just going to do the oil. So for me, it's a little bit intuitive. Again, if you're my patient, I'll give you maybe some more specific instructions. Unless you're an intuitive person, you can kind of figure it out yourself. All right, so we're going to think of depression. I'm thinking of the one that comes to mind. There was a time in my life when I was about 20 years old where I was feeling really depressed. I was in a hard situation. I didn't have a lot of support. And I'm just thinking of that situation. And it's recommended you can think it, but probably even better if you just say it out loud 3 times. I'm thinking depression, depression, depression. And I'm thinking of that situation. I'm smelling the essential oil. And then the next step is you say some descriptive words to really capture the energy of how you were feeling at that time, or possibly how you're feeling currently. So I'm thinking when I was 20 years old and I was feeling some depression, rejection, lost, alone, afraid. So usually aim for at least 3, but I say go until the tank is empty. Okay. And when I'm doing this, I'm normally taking it slow. I'm kind of in a little bit of a meditative state, or you certainly don't want to have distractions. This is kind of like a morning ritual for me, is that I'll apply this. Okay, so I'm finished with first round of depression. And then the positive emotion, the other side of depression, is alive. Okay? So I'm thinking of a situation, probably when I was more like 17, my senior year of high school. I won this big wrestling match, and the whole gym was cheering. They were cheering for me, and that's what comes to my mind when I think of feeling alive. The glory days. Okay? Alive, alive, alive. I'm going to use some descriptive words. Proud, recognized, loved, appreciated. Hero. Okay. It was a big match. I was like the hero. Okay. So now I've gone through that, then you would do the way out. Again, on my own, I would be slowing this down a little bit even more. So the way out, the phrase that she recommends is, I am glad I am alive. So you just want to feel that. You don't want to just say the words. You try and get in touch with it. You try and feel it. And then the essential oils, when you breathe these oils in, the olfactory nerve, which you use to smell, it's the cranial nerve number 1. It actually goes straight into your brain. The nerve, the sensory signals. And it's processed directly in your limbic system, which is kind of the emotional center of your brain. And it's really profound. When you put all these pieces together, I felt some very profound shifts and just really letting go of some of those old emotions or possibly current emotions. And so this is the process, and it can take you just a few minutes. Now, I don't just go through that once. I might go through it, 3 times. Again, it's a little bit intuitive. 3 is kind of the recommended. You might be done at 1, or you might need 5. But usually aim for 3. So I'd go through the situation where I felt depressed, and then alive, and then do the way out phrase. And is what you'll notice happening is the negative emotion will have less weight on you. And you might even get to the point where you can't think of the negative descriptive words anymore. It's just gone. And it's a really interesting thing. Okay, so that's the technique. If you have any questions about it, let me know. But I think that's enough for you to get started. So get started. Good luck.